Hello, Dr. Tom Lewis here with Healthy Bible Partners, and I'm talking about our 4 Dimensions of Health program, specifically Dimension 2, physiological markers, and importantly, our chronic disease temperature biomarkers. This is a combination of 20 important markers that measure your chronic health risk, where you are on the chronic disease spectrum, and particularly your risk for early mortality. So as an introduction, I really want to go into what I call a needs rationale. We have a crisis in terms of chronic diseases, but also a lot of early mortality, and the U.S. suffers more early mortality than any other developed nation on average. So let's look into what's going on and what we can do to resolve this problem. So first of all, our AI and our algorithms and protocols are developed by scientists at MIT and practicing doctors at Harvard Medical School. So we have a lot of oomph behind what we're doing, and we're presenting a lot of good research there. So what we're really talking about is we all reside on continuums of health. And in the 4-dimensional health program, we reside on 4 continuums. The second continuum is a physiological continuum. We measure that pretty accurately with our chronic disease temperature. And what the chronic disease temperature is all about is measuring your risk for early mortality. We've created a scale based on the same thing you use to measure your child's temperature, except we're measuring physiological changes in your blood that relate from a chronic perspective to that acute measurement. So an ideal number in your chronic disease temperature is 98.6. So anything between 98.6 and 99.6 is a good number. But as that number goes up, as your chronic disease temperature number goes up, your early mortality risk increases rather proportionally. So let's look at what this is all about. And really what your chronic disease temperature is, it's a measure of chronic or silent hidden inflammation that's constantly wearing and tearing at your body, at your tissue, particularly at your vessels, and leading to risks of disease associated with that of vascular risks. So here's from the Washington Post recently in 2020. Chronic inflammation is long-lasting, insidious, dangerous, and you may not even know you have it. That's the important thing. We all probably are on that chronic disease continuum somewhere. So where are you? And even if your chronic disease temperature is high, you may feel good today. So here's what an expert at UCLA says. Unlike acute inflammation, which benefits health by promoting healing and recovery, chronic inflammation is characterized by persistent increases in inflammatory proteins. These are all measurable in your blood, all throughout the body, and these are an indicator or may be involved in the damage and promotion of several major diseases. So that's really what we're measuring, and we feel it's not being measured very accurately, particularly in America, in our labs and our medical consults and visits. So here's a very recent article from the Wall Street Journal. And what it shows is that heart disease strikes back across the U.S., even in healthy places. So we think we're doing the right thing. We're controlling blood pressure, we're controlling lipids, yet it turns out that mortality in America is actually increasing. So if we look at Lexington, Kentucky, a 27.9% increase from just 2010 to 2015. The major metros, it's up. Rural areas, it's up. But importantly, even in healthy areas that you think, oh, these people are active and outdoors, mortality, heart disease, it's on the rise, not on the decline. So we're obviously not doing something right. And so if we look at it, the cardiovascular death rate in U.S. as a total is up by 4.3% from 2010-11 to 2015-16. That's a significant increase. And if we're doing the right things, we'd expect that mortality rate for cardiovascular diseases and other diseases as well to be going down, but they're not. So let's look a little more deeply into this. Here's something. Kaiser Permanente, an organization I have the utmost respect for, is the largest health system that's privately held. It's a private system. Yet here we have in 2019, at the age of 60, the chairman and CEO of that organization dying suddenly. the question you have to ask is, were they measuring him, or were the measurements just not adequate to predict this sudden death? And when you die in your sleep, you most likely had a heart attack. So here's the conundrum we have in America. I call it the American conundrum. So this is the curve of life expectancy in years. The further we go up, the longer you live, versus the cost of healthcare being spent for interventions and whatnot in those various countries. You can see that Europe and Asia, they're very long-lived compared to the United States. So we're averaging 78 years, whereas in Spain and Japan, they're averaging 84, 85, now even 86 in Spain. So if we look at spending, if you follow this curve, it simply says, from a very basic view, is that the more we spend on healthcare, the shorter we live. So obviously, the interventions that are being used in America are not solving the mortality risk problem. They're not really solving the chronic disease risk problem. So here are other prominent people who died suddenly. Jimmy Lee, one of the top investment bankers in America, died suddenly at the age of 61. Tim Russ at 58. David Goldberg was in his 40s. And this is the chairman, CEO of McDonald's, died suddenly late 50s, early 60s. And then we have other people who had unexpected heart attacks. This is John Warner. He was the president of the American Heart Association and had a heart attack at a cardiovascular conference. And here's the health coach for the Biggest Losers contest. So once again, apparently healthy people, we're missing something. We're not doing a deep enough dive, or not looking far enough into physiology to understand health. And when you look at what the Europeans and the Asians are doing, they're not spending a lot of money. So we don't need better and more precision medicine that's costly. We need to get back to basics when it comes to assessing health. So there's a real advantage to living long, and this is a large study done by National Geographic, and they looked at people all over the world, centenarians, people who live to 100, and what they showed is not only when you live to 100, you live longer, but you actually have a longer health span. So you're living longer, but you're not living in some state that we don't want to live in. You're actually living quite healthy. So if we break this curve down here and look at this, so if you live to 80, you have 19 years of declining health. And it's heart disease, stroke, dementia, cancer are the kinds of things that are leading to the debilitation and early mortality. Whereas people that are living to 100 only have 9 years of declining health. It's a huge difference in health span, and they have few truly debilitating illnesses. So the 19 years of declining health versus the 9 years of declining health, that's a 10-year health span increase coupled to the fact that you're living 20 years longer. So that's how we get to the 30 years of extra health span for people. And that's, I think, everybody who's listening, that it's their goal, to live healthier, not necessarily just to live longer. So the chronic disease temperature is a patented algorithm that we created from Harvard medical doctors and MIT scientists. And this is a portion of the report. And we give you a color-coded marking based on where any of these very important markers that predict future chronic risk lie on a scale. And we also break your risk down into categories of health, from diabetes, heart disease, stroke, cancer, and if the report went on, you'd see kidneys and things of that nature. So here's someone with a pretty high diabetes risk, and we can see they have markers that are quite high, very high stroke risk, markers that are quite high. But interestingly, almost all these markers are normal in terms of standard of care, what are called reference intervals, or normal levels in the standard of care. So a person like this might actually be considered healthy in the standard of care. But what we do is not only do we look at all these numbers and risk rate them, but we give you a single score. A lot of people don't understand their labs, but when you have a single score and 6 months later we retest and you've made some changes, this number is really what you want to look at in terms of how your health is either progressing, getting better, or regressing, getting worse. So it really simplifies understanding where you are on this physiological continuum out of the 4 continuums of health, the 4 dimensions of health that's part of the Health Revival Partners program. So understanding your labs, we give this report and information as part of everybody's report. Really, you are not a number. Your labs should be and are telling the story about your health when they're taken together. And optimal values, we don't look at reference intervals that LabCorp, Mayo Clinic, WebMD publish. We've created our own scientifically founded understanding of normal ranges based on studying the literature and looking for where markers show no increase in excess early mortality, or on the other end of the scale where we're starting to see an increase in excess early mortality risk based on a biomarker number. And the chronic disease temperature, it's simple. This single value displayed at the top of your report is the combination of excess early mortality risk from many, 20 in this case, important physiological biomarkers. So it is not your core temperature like you read with the thermometer, but it's akin in terms of risk. It's related. The 98.6 scale is the scale we use, but we're looking at a very different set of markers and a very different set of measurements. We're not looking at your core temperature. We're looking at biomarkers. So here, this person has a CDT value of 102.9. They may feel good and they may be normal in the standard of care, but obviously they have risk. No one would want to have, by analogy, a 102.9 temperature. This person has a 102.9 smoldering, ready to burst into flame temperature physiologically going on in their body. So what we also do is, if you measure before and after, in this case a different person, we measure them at 104.7, very high risk, and 9 months later with some very simple interventions, we were able to lower any number of physiological markers of the 20 that constitute the chronic disease temperature, and we were able to lower that temperature to 102.7. Yes, still a high temperature, but we're moving in the right direction. We saw a 2-degree change. So this person physiologically, from a chronic perspective, is getting healthier, and the risk of dying young is being reduced. Their opportunity for a longer health span has improved greatly by going from 104.7 to 102.7. And our goal, of course, is to get into 99 or below. So this is the introduction to the chronic disease temperature biomarkers. Next, I'm going to break down each marker one by one, all 20, in individual videos that explains where the right range for these markers are in terms of completely lowering your early mortality risk. I appreciate your time. Thank you very much. This is Dr. Tom Lewis.